Tonight's talk is on internal medicine, and how this relates to Master Tung's points, TON systems, TCM, as well as the myofascial system and lines as described by Tom Myers in his book Anatomy Trains. And so we've got a lot of territory to cover here in just an hour presentation. So part of what I want to do is I want to paint broad strokes of understanding so that you can see the big picture perspective and not get lost in some of the details. So let's go ahead and get started then. And we'll begin by taking a look at the fascial lines again. So here we see the superficial front line on the left, and then we've got the superficial back line that looks like the bladder meridian, and then the lateral line that looks like the gallbladder meridian. And then one thing I want to draw your attention to here that we're going to speak about a little bit tonight, someone had asked about treating tinnitus, which it's a difficult thing to treat. And we had a few questions come in that I want to address as well. So what I want to point your attention to here is the SCM is on the superficial front line, and it's also on the lateral line. And then this other muscle on the lateral line is the splenius capitis. So a really interesting thing going on here with the muscles. And, you know, in TCM, we think of stomach 9 as just being located anterior to the SCM, the Adam's apple, and then we've got stomach 10 along the clavicle there. But we don't really think of the stomach meridian going up to the mastoid process, but the SCM also attaches to the mastoid process. This can be related to some of the functions of points like the 3 weights and like the 4 horses, which are both on the stomach meridian. So we'll go into further details. I just want to start a little prelude there about some of the things we're going to talk about tonight and the way that that relates to tinnitus. And then here we see the front arm lines. So over here with the forearm flexors, we have the lung meridian and the pericardium meridian, the heart meridian, all transversing through this superficial front line. And then on the deep front arm line, we see that it includes the Hussey points and the bicep and pec minor. And then we see the deep back arm line over here on the right. And then on the far right, we have the superficial back arm line. And I always like to give like little exercises that you can do to embody the material, okay? And I'm going to share a new one tonight. I've never shared this. I never shared this in a webinar, but it's a really simple demonstration here to let you see how these things work, okay? So what I want you to do is take your wrist, okay, and you're going to extend it back, right? And what that's going to do is when you do that, it's going to cause these forearm extenders to contract, okay? So do that and squeeze that contraction really hard. So you're pushing your wrist back as far as you can. Squeeze that contraction and then notice where the muscle contracts. Like you're forcefully contracting your extensors, but then where does that force get transmitted to? It gets up into the deltoid, right? Can you feel that?
Yeah.
And if you continue to hold that and try to keep everything loose and put all of the attention on contracting the forearm flexors, but you'll notice that your deltoid contracts up, and then you'll also notice that your lats will start to contract as well. You feel that? So little simple demonstrations like that, like help us to embody this material. And then it also helps us when we want to prescribe movements to people. So, you know, if you're doing the balance method or Master Tung's points, we use the distal points, and then we have the client move the affected area, right? So the more that you understand about movements like that, then the more you can use prescriptive movements and the more that you can embody this material. So I would encourage you to explore through movement the way these fascial lines work through little contractions like that. We can do the opposite way where we flex the forearms. So we want to flex these forearm flexors. We want to contract them and then just focus on squeezing that, and then notice how you start to feel the force and the contraction enter up into the pecs, right? Feel that? So these little exercises like that, they really help us to, fully experience these fascial lines. And then last week we talked about the lateral line and GB21 and the way that GB21 is on this superficial back arm line and how that connects to the Sanjiao meridian, and how we can do contralateral needling as well as same side needling and have an effect there. So let's move on though to all the new material, okay? And I want to begin by discussing some key principles for internal medicine. Okay, and this comes from my over 20 years of experience now, and it comes from diving into medical research and reading a lot of material on that. And this is something that I bring into my courses. Is I bring in my experience in China. I've studied in a lot of different universities in China, and so this is like a conglomeration of like research and experience in China, and a lot of experience with Master Tung's points, and thousands and thousands and thousands of patients treated as well. So one thing that I started noticing that before I really had a whole big picture perspective on this is how like I stumbled through things for a number of years. And then when I started paying more attention to the medical research and reading that, I found that like what they were saying was basically what I had experienced in clinic and stumbled through for years to understand. And so I was realizing, I'll give you an example of this with blood pressure and treating that in a moment. But I realized that if I just like started reading more of the medical reports and the research, that would help me to have more confidence and know what worked and what didn't work. So we're going to be discussing some of that because I think this is really important in internal medicine. And essentially what a lot of the research has shown is that acupuncture is very effective for a lot of internal conditions. But most of the research has been focused on the way that it affects the autonomic nervous system. So we know that the autonomic nervous system has the sympathetic division and the parasympathetic division, and then the autonomic nervous system, it goes through and, innervates basically all the organs. And so a lot of the medical research on internal medicine in regards to acupuncture is understood in the context of the way that it modulates the sympathetic and parasympathetic nervous system. Okay. And so just understanding that and understanding what the research has shown, it can give you more confidence, and it can prevent you from stumbling through years of practice, recognizing when hypertension responds well to acupuncture and when it doesn't. Sometimes it responds great and other times it doesn't. And the research has kind of clearly defined that. And the medical research, it doesn't have to take away. Sometimes I talk to people and they think that it takes away from the traditional methods and the classical systems, and it doesn't have to do that. Like, it can complement it. I'm a person that likes to integrate different systems in different ways. So if you're like a traditionalist, like it doesn't have to take away from it. It can just complement it. Okay, so let's look at some of these key principles for internal medicine. The first point reads, internal medicine is often related to chronic imbalances, genetic predispositions, infections, traumas, and other complex patterns and conditions. Okay, so first point there. And, if you're using herbs, that's one thing. We're not going to talk about herbs much, but for a lot of years, like I was using herbs. And if you spend any significant amount of time in China, you'll find that if you study internal medicine in China, you usually end up in an herb department. Whereas with acupuncture in China, they're treating a lot of pain and musculoskeletal and neurological things. But when it comes to the internal organs and the different divisions of internal medicine, then you usually end up in an herbal department. So for a lot of years, I was using herbs and I had access, but I've traveled extensively through Asia and lived in Asia for 12, 13 years now. And in a lot of the work environments where I was in rural places in Asia, like I didn't have access to herbs. So I only could use needles. So that took me a lot of time to like really kind of understand, oh, I don't have my favorite herbal formulas. What am I going to do then? So moving along here on this, the second point reads, research findings have demonstrated acupuncture to be beneficial for many internal disorders, but they tend to require a longer course of treatment, typically between 6 to 12 sessions is common. Okay, now if you're doing Master Tung's system and you're using herbs, then you may not need to use that many because herbs are so widely used, as I was describing, in China for internal medicine. However, if you're only using acupuncture and they don't mix the herbs with the acupuncture in the research because they want to know what the acupuncture is doing. So if you're only using acupuncture for treating internal disorders, generally expect that it's going to take 6 to 12 sessions to get like the best results that you can. Now, that doesn't mean that you won't see the miracle cases. Like I could share plenty of miracle cases in internal medicine where they had a chronic internal condition like urinary tract infections that would turn into kidney infections and food allergies, and the list goes on and on and on, and actual liver diseases and different things that I've seen and treated. But as I was saying before, like after seeing so many patients for so many years, I started to realize that it generally takes, like, for the median average person, like it's going to take 6 to 12 sessions for a lot of internal things, especially if they're chronic. So yeah, miracles do happen with the Tung points, but just knowing that, and this comes from research in digestive conditions and heart conditions and hypertension and gynecological conditions and many different sort of internal type conditions. So knowing that, I think, is helpful. And the third point here, which I think is really big, is that it says long-term benefits are also observed in the studies. So if you are able to get a person through a complete course of treatment of 6 to 12 sessions, then there's a better likelihood as well that they're going to get the long-term effects. So, you can take them through 6 to 12 sessions in a few weeks or a month or whatever, and then they'll get benefits for the long term. And typically in a lot of the research, they look at it like 6 months later and a year later, and they find that those results and improvements that are made in those 6 or 12 sessions often do have long-standing benefits. So I think that's a really important thing to understand and be aware of. And then the next point here reads, I call it the 4+8 treatment principle. Okay, because if you have a new person walk into your office that's never had acupuncture and you tell them that they're going to need 6 to 12 sessions, it doesn't really work so well. Okay, so in the 4+8 principle, what that means is typically what I'll do is when I see a person, I ask them about their top 3 health concerns. And then from that, I'll go into 10 questions and diagnosis and everything and pattern identification. And then after I've talked to my clients, like the first time that we've met, I'm going to give them my most honest opinion about what I think I can do for them and what it's going to take. But I typically don't tell them if I think they're going to need 10 or 12 sessions, like you know, I may or may not tell them that. What I want to do, and what the 4+8 principle is if it's a chronic internal condition that they've had for a long time, and I know it's going to take a number of treatments, I want them to commit to 4 treatments to start with. Okay, and I tell them that. And I'll tell them, look, you know, this is a chronic thing that you've had for a lot of years, and I think we can get great results with it, you know, based on my experience and based on what I know about it. But it's going to require a commitment on your part. Like, you've had this thing, you know, your diet's been off for many years, or, you know, like I'll comment on their lifestyle, right? So this has been building up. You've got diabetes, and you've got heart disease, or you've got a fatty liver, or, you know, you've got this chronic kidney disorder, or whatever it is, right? Well, this has been building up for years, so you can't expect like just 1 or 2 sessions to like get rid of it and cure you from it. And people understand that, and they appreciate that direct and honest feedback. So I'll tell them, look, you know, I don't know how you're going to respond because I've never worked with you, but I suggest that you start with 4 sessions. That way you're getting a commitment from them, and you're giving yourself and them enough time to see what the acupuncture can do. Okay, does that make sense? Now, for some cases, you know, you're going to give them the first treatment, and if you're doing Master Tung style acupuncture, like a lot of times they may get 40 to 60 or 80% improvement straight away. You know, that does happen, right? And, you know, there's a lot of clients that I take through, and I do the 4 sessions, and they're doing great. And, you know, maybe they don't need more than that, because 4 can often be enough for people too, even for chronic things. I just treated a chronic kidney condition that a woman had, and we got great results really quickly. It didn't take many sessions at all. And then at the end of 4 sessions, then you're in a better position to understand how they're responding, and you're in a better position to, provided that they've gotten benefits, you're in a better position to then get them to commit to, you know, 4 more treatments or 8 more treatments if it's something that's going to take 12 sessions. Okay, so just some kind of basic things that we need to understand here about that. So the 4+8 treatment principle, if you get them to commit to 4 the first time you see them, then you're giving yourself and them enough time to address chronic and difficult treat conditions. Okay. Now, the other thing I do here too, I've mentioned this before, I'm just going to quickly mention it now because I'm going to come back to it at the end, is ask them about their top 3 health concerns. Okay. A lot of times, just by doing that, I know the Zong Fu pattern and the meridian systems pattern just from doing that. And then if you ask 3 questions about their top 3 health concerns, 3 times 3 is 9. So you've basically done your 10 questions already. Now, the other thing that I want to emphasize about this too is, and excuse me if I go on too much about this top 3 health concern thing, because I do drill on it a lot, but it's a really important thing to understand. The other thing is, say someone comes in with a difficult to treat condition like dizziness or tinnitus or neuropathy or, you know, chronic asthma, something that's difficult to treat, or hypertension. So say they came in with something like that, right? And say that, you know, like we've discussed, that the medical research shows that for treating IBS or some of these digestive conditions like that, typically like at least 6 treatments are needed, but up to 12, okay? So you know that for a lot of these chronic internal conditions that 6 to 12 sessions are needed, okay? So if you ask them about their top 3 health concerns, let's say their number 1 is a difficult to treat internal condition, it doesn't matter what it is. So you ask them about their second concern, and they say something like neck pain or headaches or back pain, or something common that a lot of people have, and something that responds really well with acupuncture really quick. Okay, so you've got their number 1 priority is something that's internal and difficult to treat, and their number 2 priority is something like headaches or neck pain or back pain or knee pain or, you know, carpal tunnel or elbow pain or something that responds really quick and really easy with acupuncture. Okay, so if their top concern is something difficult and their secondary and third concerns are easy to treat, guess what? After I've taken them through those initial 4 sessions, then guess what? Then they're going to have a higher commitment level to follow through with a whole treatment course that's really necessary for some of these chronic internal conditions. Does that make sense? Yeah, you get that? Thumbs up? Thanks. Okay, so that is such a major thing. Like when I started doing that in my practice, you know, with some of you, we got a lot of different people here. We got really experienced people. We got some people that are more new to this. And when I just started asking people about their top 3 health concerns and checking in with them after the 4 sessions and saying, okay, look, the neuropathy's difficult to treat. I told you that right from the start, but you're telling me you're getting a little bit of improvement. You know, you're saying that you're 20% better with your neuropathy, or you're 40% better, or whatever, right? But your headaches are gone and your neck pain's gone, and you know, your knee pain is better too. Look, we're getting you progress. So just like bear with me. Let's do another, you know, let's do another 4 or 8 sessions, because then I think we can get you from 40% improvement with the internal condition clear up to, you know, the next level. Okay, so that's why I do that. Okay, so when I did that, because a lot of you, like if you're new in practice and you're just asking them about their chief concern, you know, they come in, they talk about their primary concern. It's a difficult to treat internal condition. You go to 10 questions. And if you go into 10 questions from just their primary concern, guess what? You're in a really complex pattern, you know, and maybe they've got 5 different Zong Fu patterns going on. And then what are you going to do? You just opened up a can of worms. But if you ask them about their top 3 health concerns from the start, before you do 10 questions, guess what? You've prioritized their needs. Okay, that's much different than asking about their chief concern and then going into 10 questions. If you do that, you're subject to misinterpreting things, and you're not placing their priorities first. Okay, so by asking their top 3 concerns, you're placing their priorities and needs first. And guess what? Like those things are always interrelated too. You know, like I can always draw the comparisons. Now, the reason I'm spending so much time on this is because when we're working with internal medicine, especially if you're using herbs, you're still going to want to use your Zong Fu patterns, right? Zong Fu pattern identification is best for herbs. But for acupuncture, as Dr. Tung taught, if you've done the balance method and Master Tung's points, we know that the meridian systems, the 6 systems, are a better way to approach acupuncture, right? So let me just kind of jump ahead here. I want to show you something. Okay, so see this triangle here? This is something I call 3D analysis with Tung systems and internal connective tissues. This is in my internal medicine course. Okay, and this is like one of like 3 major components to it. So we want to find the sweet spot when we're working with our clients. Now, if you're only doing Zong Fu pattern identification, right, you're only just at like, you're only seeing things from one dimension. Or if you're doing, you know, maybe you're doing Zong Fu and 5 elements, and that's great. And I respect the classical systems. I love the classical systems. They're beautiful. But you're really only just seeing one dimension of what's going on. Okay. Now, once you start to plug in Tung systems and balance method stuff and global balance method, then you start to work into that second dimension. And remember how powerful it was when you were just doing TCM, you know, because I think it's the standard in education, right? So you come out of school, you're just doing TCM, you practice that for a while, and then at some point you find the balance method, and then wow, it's like, you know, you get results like so much better, so much faster, right? Like when I found the balance method, I went from seeing like 20 people a week to 60 and 80 people a week, like in 6 months' time, from the effectiveness of the treatments. And then some of the practice management stuff too, by asking them about their top 3 concerns and getting them to commit to 4 sessions, and then, you know, these types of things. There's some practice management stuff. But to go from 20 people a week to like 60, 70, 80 people a week in 6 months, it was amazing. And I attribute, most of that to the effectiveness of the balance method, because like you can have good practice management skills, but if you don't get people results in the end, then you're not going to get referred to, and they're not going to come back, and they're not going to prepay you for 10 or 15 sessions. So now, similarly, okay, if you're just doing the balance method and Tung's points and Zong Fu right now, you're great. You can go a long ways with that. But similarly, if you understand the myofascial lines, it's going to propel you to that next level, just like learning the balance method did. It's going to fill in so many gaps for why points in the Tung system do what they do. It's going to just accelerate your practice that much more, even if you've done it for 10 or 15 years. Okay. And if that doesn't happen, like if you are doing my course or you've purchased my course, and if you don't find that the benefits are that good, let me know. Let's talk about it. Okay. That's how confident I am that this stuff will radically change your practice. Okay. So let's see. Let's make sure that we got all of that. Okay, so some general guidelines on key principles for internal medicine. Now, this is something that I worked out with an osteopath, and this guy had a degree in traditional Chinese medicine, and then he had a degree in osteopathy, and then he was going on to get his medical degree as well, and he's since got that. So he had 3 degrees, and he taught me a lot about how to do this and all the implications of this. He was doing the balance method as well, but this is a general guideline that I like to use, and it's starting with the more distal points, either on the hands or the more distal points on the limbs. In the Master Tung system, if you're really good at it, you can often get by with just using 3 to 6 needles. When I was doing group acupuncture for a lot of people and seeing a lot of people in an hour, I would just use 3 needles for most people. A lot of times when I see clients now, I'm just using 6 needles. Okay. And the general guidelines then start with the more distal points, not the ones on the fingers or toes. Like, they can be great. I don't use them a lot. I won't go into that, but I use them sometimes. I think, they're great too. But the ones on the hands and the feet, like the more distal ones on the arms, the more distal ones around the ankles, like I tend to start with those as my first 3 points. Okay. And then I'll slowly move more proximally as needed. Okay. I don't want to spend too much time on that, but this does relate to internal medicine, because if you start to look at the Tung points, like if you look at the points on the arm, 44.08, 9, and 10, those ones right there, they treat a lot of internal conditions. And a lot of the more proximal points are used for a variety of internal conditions. So internal chronic conditions, we want to start with the distal points because they typically provide the fastest results. Okay, so I'll put 3 points in more distal, distal from the pain, and then give the patient 10 minutes and then come up and check on them and see how they're doing. And if the pain's still there, then I'll add 3 more. If it's not, then I may not either. Okay, so there's a lot more I could say about that, but I'm just going to leave it at that for now. The Dao Ma technique, you should definitely be doing that and using groups of 2 or 3 points together in close proximity. Probably already know this. And you also got to consider the constitution of your client, for internal conditions, and not just internal conditions, but everyone. So big body types generally need more needles and stronger stimulation and the more intensive points. And then the thin reactive types, like make sure that you're not using too many needles on them. Thin reactive type people, like you don't need to put 8 points in them. A lot of times 3 is enough. But respect everyone's unique differences. I had a client fairly recently. She had a very thin and reactive body type, but guess what? She loved needles. She put like, needles that I needed to do. 6 needles were enough to get her top 3 health concerns. So I would put the needles in, right? But she just loved needles. Like she did really well. And even though she was a thin and reactive body type, like I would do 12 or 15 needles, not because I needed to, but that's just like what she liked and how she responded. So kind of, it helps to understand the body type. So athletic builds too, like they tend to require stronger stimulation. Sensitive types, we've talked about that. Okay, last point here. It says, to increase your skill level with acupuncture, consider delaying the use of herbs for some cases, okay? So if you really want to get good at internal medicine with acupuncture, then simply don't give them herbs the first or second time. Just delay the use of it. See what results you get with the needles, okay? And because I was forced to not use herbs because I was working in rural and distant locations, like out in jungles and in various environments like that, like I didn't have the herbs available. So it forced me to get really good at acupuncture for treating internal conditions as well. There was a rural place where I was spending a lot of time, and a common thing that was happening to the women there is they were getting urinary tract infections. It was a tropical environment. They were getting urinary tract infections. I would see urinary tract infections all the time. And in the Tung system, first few points that come to mind are like the lower 3 emperors, right? And, you know, Lingu as well for kidneys. And then when I was treating them, so I was doing that for a while. I was doing like the 3 emperors for, and you can apply this to gynecological things too, though, but for like genitourinary and gynecological things, I would do like Lingu and the 3 emperors and Dabai, right? And like for these women that were having the urinary infections, like I would get some benefit, like it was working, but it wasn't, you know, the strongest benefit. I needed more, like. So I had to like think, well, what else can I add to this? You know, how else can I address this? So I started looking at Tung's points again and like, oh yeah, I can use 22.06 and 22.07, right? Like those ones are also indicated. And then what were those other ones? The passing through kidney points, right? Like I could use those. But this was before I understood the myofascial lines. And I've mentioned this before, but just because I'm talking about urinary conditions right now, I want to draw your attention to this. So here on this slide here, we see the deep front line, and then here we see the superficial front line. Okay, excuse me one moment. Okay, so here on this image, we see the deep front line and the 3 emperors, or the band from spleen 6 to spleen 9, that's all going to reach that deep front line. Now, this is the superficial front line, and the points 88.09 and 88.10 and 88.11, the passing through kidney points, they are on the superficial front line. Okay, so the treatment that I was doing for urinary conditions and gynecological conditions at that time was the 3 emperors and then, you know, Lingu and Dabai, right? Great, got results, but it wasn't, you know, it wasn't like quite as good as I wanted either. People would get benefits for a few days, but then they'd come back and then I'd have to do the session again. But then, like when I started to understand these myofascial lines, I realized that if I put the passing through kidney points in, guess what? It's working on the superficial front line. Okay, so I can do the 3 emperors on one leg and then the passing through kidney points on the other leg. And then I've reached the deep pelvic fascia on the deep front line. And then I've also reached the anterior or the abdominal wall here. Well, there are fascial connections from the bladder to the abdominal wall. Okay, so you're working on those anterior fascial relationships when you do those passing through kidney points, but when you do the lower 3 emperors, you're going to be working more on the deep pelvic fascia. Now, the medical researchers also know that when you needle into The lower three emperors are in the spleen 6 to spleen 9 band. That it affects, I think it's the S1, S2 nerves, and that has a beneficial effect on urinary conditions. Let's jump ahead here. Liver stuff is always important. So we talked about the sweet spot here and how you can find a sort of three-dimensional perspective if you use traditional methods like Zongfu and 5 elements. And then when you use Master Tung's points and Tan's systems, you've added that second dimension. And then when you start to add in the myofascial lines and the internal visceral fascia into this, then you're going to get a three-dimensional perspective on this. So if we look at the liver, for example, here, let me show you some of this. So here we see the liver relationships with Tan systems, right? So the liver pericardium connection here is the Jue Yin connection. That's the system 1 connection. And then the system 2 connection is the liver large intestine connection. So that's that Jue Yin Yang Ming relationship, the system 2 connection between the liver and large intestine. The system 3 interior exterior relationship is with the gallbladder. The system 4 connection is opposite of the clock. That's with the small intestine. And then the system 5 connection is with the lung. Okay, so we see these here. Now, if we look at the liver and the connective tissue that surrounds it, guess what? We find that there's an anatomical basis for some of this stuff. So looking right here, and this, I've taken this slide here from my internal medicine course, okay, where I go through and we go through all the visceral fascia and show how it relates to Tan's systems and how it relates to Dong's points, how it relates to Zongfu stuff, and how it relates to the global balance method. Okay, so it's bringing all of these three things together, basing it in visceral fascial anatomy and the myofascial lines. Okay, so the liver here, if we look at the top of the liver, it's surrounded by the visceral fascia, and then at the top we have the coronary ligament. Okay, so there's a direct connection from the liver to the diaphragm. We see that there's the right triangular ligament, and then the coronary ligament here in the middle, and then the left triangular ligament on the left side. So a direct fascial relationship between the liver and the diaphragm. Okay, and then on the other side of that, we've got, guess what? Pericardium connects to the diaphragm as well. So that diaphragm and the pericardium, and then the connective tissues surrounding the liver, the diaphragm is the convergence point. Okay, now if we come down here, we've got the anatomical relationship with the colon because it's in close proximity, and then we've got fascia to the kidneys as well. There's our liver kidney relationship, and then we've got the gallbladder, which of course we know how that is in relation with the liver. But then there's also the lesser omentum, it's called, that connects the liver to the small intestine as well. So this here reads the common bile duct and stomach are connected to the liver via the lesser omentum. Okay, so remember the bile duct opens up into the small intestine. And so here we see a connective tissue basis for a liver small intestine relationship as well. Now, the big one here that I want to spend more time talking about is, see these arrows here? This comes from a book called Visceral Manipulation and Osteopathy. So I've been fortunate enough to have friends and colleagues who are osteopaths that I've worked with, and I've been able to collaborate with them and share with them. And that's really helped me to have a lot of tremendous insights about things. So these three arrows here, okay, are connecting to the abdominal wall, okay, so via the falciform ligament. So we've got three connections to the abdominal wall via this falciform ligament. Okay, so let me go to, I want to talk about the four horses now. Okay, so on the abdominal wall here, we've got these ligaments from the tendon connecting on the interior side of that to the interior abdominal area. Now, we know about the four horses, right? Okay, and typically, like when we learn those, we learn that they're for skin conditions and respiratory conditions. But did you remember that they also treat costal pain? How many of you remember that? They also are indicated for tinnitus. these are those like secondary and tertiary indications that we so easily forget about, right? If you're trying to learn Master Tung's points, or if you're still doing TCM and you're trying to memorize all those secondary and tertiary indications for the points, guess what? Like, it's hard to memorize everything, right? Like you just can't memorize all that. But if you learn the anatomy, then it makes sense, right? So the 4 horses and the 3 weights as well. Remember that the 3 weights can also be used for treating liver and spleen, stomach disharmonies, right? So on the superficial front line, then we've got, let's go back to this liver connection. We've got connective tissues from the liver, highly connected to the liver, associated with the visceral fascia, going and connecting to the abdominal wall via this ligament here, okay? So I think that has something to do with, I'm trying to find this other slide. I thought I wrote this in here. Where do we put this? Okay, oh, it's right there at the bottom. I just added this last minute, so I kind of forgot where I put it. So 4 horses and liver patterns, okay? The 4 horses are also indicated for intercostal pain, tinnitus, and skin conditions. And remember that skin conditions from a Zong Fu perspective can have a basis in the liver too, right? Like for a lot of skin disorders, there's that liver relationship as well. So we can use the 4 horses for that. Now, if we look at the superficial front line again, remember the 4 horses for TCM people are right here in like the stomach 32, stomach 33 area, in the mid area of the quadricep there. So if we look at this, right, we can use the 4 horses for intercostal pain, which is maybe something you forgot about. But look where the superficial front line connects. It connects to the sternum, and the ribs meet the sternum, right? So anatomically, and through the principles of tensegrity, I think that this is probably why the 4 horses are able to treat costal pains, because it's having an effect on this myofascial line, the superficial front line. And it's the same with the 3 weights that are down here, okay? And it's the same with stomach 38 from a musculoskeletal perspective. We can use stomach 38 to treat shoulder pain, likely because of this connection with the clavicle here, okay? So the clavicle is one of the 3 primary bones that makes up the shoulder joint, okay? So we can use those. And then we've also got the Master Tung points, the spleen points. I think, is it 88.09 through 88.11? The passing through kidney points can also be used for clavicle pain, right? Because of this relationship here. So if you're trying to memorize all the indications, I tried to do that with Master Tung's points for the first 10 years. And of course, you can apply the traditional methods. You can apply the traditional methods of Ton's systems and, you know, these correspondences, and that works great. But still, you still have to kind of like force yourself to memorize all these indications. But, and this is one of the key things I really want you to take from this, is that if you just learn the anatomy, then all that stuff that you're trying to memorize and can't remember, it's all just going to fall into place. Does that make sense? Because we're taking it all back to anatomy, okay? Which makes it really simple and interesting. And if you're really into movement, like I like to spend a lot of time moving and doing yoga and qigong. And if you're really into movement and these things, then guess what? Like you can just add to that. Okay, what else do I want to show you here? So in the internal medicine course that I have as well, we talk about the visceral fascia, like we discussed here, and we draw the comparisons with the visceral fascia and the way that it relates to Ton's systems, and we ground that into the anatomy of the myofascial lines, as well as in the anatomy of the visceral fascia. So let's look at the global balance method stuff, or what I like to call the meridian circuits. And here we see that the Jueyin meridians here, the liver and the pericardium, or the Jueyin, right? They connect to the gallbladder and Sanjiao. So if you just look at those parts, then those 4 here, that's the Shaoyang Jui Yin circuit, right? So if you know the balance method, you should know that. Now, this one here, right, this is the Jui Yin Yang Ming circuit, okay? So whenever you see a liver pattern, then you need to distinguish between, is it a Shaoyang Jui Yin pattern or a Jui Yin Yang Ming pattern, or what sort of liver pattern is it? Now, a lot of you are probably already doing this, like if you're really fluent in the balance method, but this is really important to revisit with internal medicine, okay? So let's see if I can find, here's all the different liver pattern circuits, okay? The liver pattern circuits, number one, the Jui Yin Yang Ming circuit, and then number two, we've got the Jui Yin Shaoyang circuit. Another liver circuit is the Jui Yin kidney large intestine circuit, okay? Let me show you. Okay, here we see the Jui Yin Yang Ming circuit. Well, we can replace the stomach here with the kidney, because the kidney connects to the pericardium, that's system 5, and then the kidney also connects to the large intestine, that's system 4, okay? So if we put the kidney in there instead of the stomach, that is the Jui Yin kidney large intestine circuit. And this one's quite common to see, especially in older people that have like kidney yin and kidney yin and liver blood deficiency, or the kidney liver deficiencies. And then what do people with that often get? They often get like insomnia or hypertension, right? When the liver yang starts to rise. So it's quite insightful to like understand each of these circuits and have them totally dedicated to memory in your mind, so that you can just ask people about their top 3 health concerns and find out like what circuit it is that they have. Okay, so some of the other liver circuits here, the wood fire circuit, and then the liver large intestine lung liver circuit, and this one as well. Let me see, we got this one here. Okay, so liver points patterns in internal medicine. Okay, the way that we can look at liver conditions are, there's like liver diseases that Western medicine recognizes, and these include things like high liver enzymes, fatty liver syndrome, hepatitis, liver failure, cirrhosis, etc. Okay, so like actual organic conditions of the liver are one category of liver conditions. Now, in TCM, we recognize that a lot of neurological conditions are liver related, right? So strokes, liver yang rising, tinnitus, migraines, these types of things, right? Parkinson's. So if it's a neurological type liver zong food pattern, we're primarily going to be doing points on the Shaoyang Jui Yin circuit. Okay, so these circuits help us to determine how or what points we should use. And then for gynecological patterns, right, a lot of gynecological conditions are liver related. And right here, I've written that spleen 6 teaches us we can consolidate liver, spleen, and kidney points in the DFL, in the deep front line. So spleen 6 is the 3 yin crossing point, right? And let's go back to the deep front line. So all those points, you know how when you're first learning it, and even still after all these years of doing it, right, those points that are on the lower leg, so from like spleen 6 and liver 5 and the kidney points and the spleen points, in the Master Tung system, the spleen and kidney essentially, and even the liver, all those meridians get consolidated into the 3 emperors, right? Like we don't do any liver points in Master Tung system on the lower leg, right? We do them here in the medial thigh, or we do the points on the feet. So all those points in the Tung system in the lower leg, they get basically consolidated into the lower 3 emperors in 77.21, right? Now, how do we relate that to the deep front line? Well, we have to look at the muscles of the deep front line, okay? So we've got the tibialis posterior, which is really the main muscle on the deep front line that we're going to be using. And that's why the dung points get consolidated is because when we needle those points, provided that we got the right depth and angle, it's going to be working on these deep frontline fascia, okay? And that's why these points, in part, are so good for pelvic related conditions, is because you put needles in here and then it's going to have effect here. Now, the nervous system's still involved, and we still have chi, and we still have these things, and hormones are going to be involved. But if you practice the principles of tensegrity, and if you've embodied that, you can come to understand this from a myofascial line perspective as well. Okay, so gosh, I always try to follow this in a linear sort of way and end up jumping around a little bit. I'd like to teach in a more circular way. Okay, so one of the last things I want to say here, this is a really important point to make. In liver digestive patterns and conditions, okay, oftentimes when we have some sort of digestive disorder, we'll often think about like liver overacting on the spleen and stomach, right? So we've got this Jui and Yangming circuit, which is a really common circuit that you see in clinic. But whenever you see a liver-related digestive condition, you also need to consider this circuit here, okay? So the liver is connected to the small intestine, and then in the dung system, right, we have the small intestine points, or the points on the small intestine meridian, 33.10, 11, and 12, right? We can use those as a Dauma for liver-related digestive type disorders, or we can just use like 33.10 and 33.11, okay? So this is because of the small intestine liver connection, and the small intestine also connects to the spleen, and then we've got the lung there as well. Now, the reason that I mention this is because if you've done, the dung system, like you may be using these points here, and it's helpful to take it back to this circuit and back to their top 3 health concerns, okay? So if you're treating a person for a chronic, difficult to treat digestive internal conditions, you don't want to be doing, Li4, lean goo, or just large intestine points all the time. You got to change it up, especially if it's a condition that is going to require a whole course of treatments, like maybe 6 or 12 sessions. You need to be mixing those small intestine points in there, especially if they're complaining of like pain at SI13 or scapular pain. And this is why you ask about the top 3 health concerns, is because if they have any sort of digestive symptoms that are rooted in a liver pattern as their primary concern, but then secondarily their primary or their second concern is involving scapular pain or pain at SI13 or pain up into the neck, then it's probably better to use those small intestine points, 33.10 and 33.11. because then you can get that secondary concern, and then you're also addressing that small intestine liver relationship. And if you look at this myofascially, like take your arm and fill this gap, like go to the ridge of the ulna, and then notice that there's a gap there, right? And then you've got this space between the muscle and the bone. And then that in the middle there, you're going to have connective tissues all in there. And it's very similar to stomach 36 and stomach 37, or the 4 flowers, where we move the points adjacent to the tibia, right? So anatomically, they're very similar because we've got that gap. Like just palpate, you can feel tibialis anterior, and then we've got the ridge, but we still got that gap, right, between the muscles and the connective tissue. So there's an anatomical similarity in the muscle and the space between it and the connective tissue. And I suspect that that plays some role in this as well. I'm still unraveling some of the mysteries of all of this. But I can also map out fascially, if we look at the small intestine line, let's look at that. So the rhomboids are right here. So when you needle these points on the small intestine line here, like it's going to affect this deep back arm line. It's going to affect the rhomboids. But there's also a relationship, it's not shown here, this is in the course. There's also a relationship between the rhomboids and the serratus anterior, which runs down this way. And I think that's why you can use those points for liver-related conditions, is because as you come down, serratus anterior wraps around the ribs, right, in the costal area where we think of it, liver symptoms. And so we've got a sort of myofascial explanation there as well. And this just goes on and on and on. There's only just so much I can present in an hour or anything. Okay, let's just quickly go over some of this with tinnitus and dizziness, because someone asked about this. How do you treat tinnitus? And I'm going to put dizziness in there too, because they're very similar, and often, like from a Zong Fu perspective, we see it as like a liver gong rising type condition. Okay, so here we find that, now I pulled from various sources. I pulled from Mira and Lee's book and Dr. Young's book, and I pulled from a few different sources, but some of the more common points that you find for treating tinnitus in the Dung system are the 4 horses. That was really, like, between all these different references, that was like the #1 indication. 4 horses, like, how do we explain that then? There's different ways to explain it classically, but if we go back to the superficial front line, right, we find that the SCM is a part of that, and the SCM connects to the masseter. Okay, so that's a key area in, you know, the ear and what's going on in that region as well. And I also came across, I think it was, I tried to find it and add it to this slide, but I couldn't find it. I think it came from the Trigger Points book by Travell and Simons, you know, the classical book on trigger points. And one of those books like that. And they were talking about trigger points and some of the muscles on the legs, and they had made an association and found that, like, the trigger points in the leg were associated with the ear and tinnitus and some things there. So you can find that there's, like, these biomedical explanations that support a lot of this when you look into the trigger point perspective of it too. Okay. So I think that the SCM's playing something there with having a role in that. Now, another common group of points that came up were 22.08 and 22.09 on the small intestine meridian and on the deep back arm line. And with these, like, so if you have a client, right, that has, and this is why it's important to ask about the top 3 concerns too, is let's say they have a primary concern of tinnitus, but a secondary concern of neck and cervical conditions, and it's involving the small intestine meridian. Guess what points I'm going to use then? I'm definitely going to use these. Okay, so by understanding the myofascial lines, this is a key benefit of knowing this stuff too, is it helps you to distinguish what points you should use. Because if we look at these points for tinnitus, right, like, how many different point groups are there? There's tons of them. We got 4 horses, we got 22.08 and 22.09, we got the lower 3 emperors, we've got Lingu, we've got GB31, we've got 3 weights. There's other points too. We've always got these long lists of points that we can use for any given condition. You can apply Tan systems and Zong Fu systems to understanding that, but as you integrate the myofascial line into this, you're going to be able to better assess what points you should use. So if I have a patient that has tinnitus and asthma as their secondary concern, right, and they have or digestive problems as their secondary concern, guess what points I'm going to use? Like, I'm going to be looking at using 3 weights and the 4 flowers, because that superficial front line's affected, that stomach meridian's affected. Okay, so when you ask about their top 3 concerns, they're always going to tell you their most relevant and intensive symptoms that they have. They're not going to tell you about something that you find in 10 questions that's obscure to them, right? They're going to tell you about their most bothersome conditions, right? So when you do that, it'll help you decide, well, you know, maybe I don't need to use the gallbladder points, because a lot of times we might think, oh, tinnitus, right? Use the gallbladder points, right? Like, you know, I would still think that. I'm going to think that, right? Liver yang rising, use the gallbladder points. But, right, if their secondary concern is involving the superficial front line or the yang ming meridians, then I'm going to be thinking about that Jui yin yang ming connection, and then I'll be able to use points that are going to address not only their primary concern, but also their secondary concern. And if you get fluent in Zong Fu and meridian systems, global balance method, and the myofascial lines, guess what? You can ask people their top 3 concerns, and you can go through it real quickly and say, okay, boom, what you're describing, they're describing that. I'm talking to them about their top 3 concerns. I'm asking them a few questions. And at the end of that, I know exactly what 3 points I want to use, because I've integrated all 3 of those systems: the classical systems, Ton stuff, Tung stuff, and myofascial anatomy. And that's what will allow you to use fewer points and get better results when you're totally fluid in all of those, and you take that back to their top priorities, the top 3 concerns. Okay, so I hope that's clear. I'm going to go ahead and I tried to find the questions section, or what people are saying. There we go. Okay, so just want to look through here and see, does anyone have any questions before we end? Anything come up? Anything we need to address?
I wanted to know, like, where do you search for your medical journals? Do you just go on PubMed or different things like that, or do you subscribe to any particular things?
Yeah, PubMed, and I have the book Medical Acupuncture by Elsevier Publications, and they've got thousands of things that they've referenced in there. Like, if you're really into that biomedical stuff, get that book, because they've cataloged it all. Like, I pull a lot from that. But yeah, PubMed, I'm on it every day. Okay, anything else? Okay, so here's a question. It says, how do you come up with the meridian systems for tinnitus? Just whichever connect to your ear. I'm glad you asked that. I don't come up with it. Their body comes up with it by asking about their top 3 concerns. What's your top 3 concerns? Tinnitus. What's your secondary concern? Oh, I've got IBS as well. Like, I've had food allergies my whole life. Okay, what's your third concern? You know, whatever it is. By taking their top 3 concerns, and then I've just done this for so long that it comes really quick, but by taking their top 3 concerns, so what I would do is I would write down, let's say their top concern is tinnitus, right? So in my notes, I would write, usually I'd write like liver, kidney, because that's how we think about it, Zong Fu. So I would just write LV/KI in my notes. Tinnitus, LV/KI, Zong Fu, done, okay? Because a lot of times it's liver, kidney deficiency, yang rising. So how do you come up with meridian systems for tinnitus? So top concern, tinnitus, I'll write in my notes, liver/kidney. Secondary concern, it's, let's say it's IBS, right? Then I'll ask a few questions, you know, like, where do you feel it? Maybe I'll palpate the abdomen. Is the constipation worse or the diarrhea worse? You know, maybe I'll look at the tongue too. Oh, okay, let's say it looks like more like a spleen deficiency pattern. So then I would write, you know, spleen. Okay, so then I've got, or let's just say it's liver spleen, right? So it's a liver spleen pattern, IBS. And then third concern, whatever that is, let's say it's like neck pain. Okay, and it's at small intestine 13 and the levator scapula is affected. Then I would write small intestine, SI, in my notes. So top 3 concerns, tinnitus, liver, kidney. Secondary concern, IBS, liver, spleen, LVSP. And then third concern was levator scapular pain, SI13 pain, small intestine, right? Okay, that's how I do it. Just real simple, right? And you can write that all shorthand. So then I start thinking, okay, how is all this connected? How am I going to be able to use like 3 points and address this stuff, right? or 6 points. So I'm thinking, okay, let's stick with the Zong Fu stuff. It's liver, but then they've got stuff going on in the small intestine meridian, and there's that LV, liver small intestine relationship, okay, and then the spleen, but the spleen also connects to the spleen also connects to the small intestine and the liver both, right? So see how that's coming together? And then if we go back and we look at this other circuit here, this obscure circuit that everyone forgets about, where did that one go? This one here. Okay, so first concern, let's say the Zong Fu pattern is like a liver kidney condition. Well, guess what? In the Master Tung system, the liver and the spleen and the kidney, they get consolidated on the deep front line, right? So then I'm going to think, well, should I need a liver 2 and liver 3, or 66.03 and 66.04, or should I do the lower 3 emperors, or some combination of 3 needles on that band there from spleen 6 to spleen 9? Okay, which, well, those are top points for tinnitus as well, right? And it's addressing the liver, kidney, spleen stuff that's going on, right? So then the top concern is tinnitus though, so I want to prioritize that. And I've already explained to them too, you know, like I'll tell them, well, okay, tinnitus, yeah, you know what the medical research is? They have found some research that indicates that acupuncture may be beneficial, but it's one of those conditions where it's still inconclusive. They found some of the research says, yes, it can be beneficial. Some of the research says, no, it doesn't work. They're still trying to work it out. So we really don't know, you know, it is a difficult thing to treat. It's going to take more sessions, but for IBS, right, that's something that we can get good results with. And if you do dietary coaching, and you know, we're going to not use herbs too quickly because we want to see what the acupuncture can do. But this liver spleen pattern is part of the IBS, is part of this too, like right there, right? And then that third concern of shoulder pain, I'll tell them, like, I'll say, look, you know, the shoulder pain and the stuff going on, I can take care of that. And what I'm going to do is I'm going to do a few points for that. I'm going to show you some movements. I'm going to get your neck better, because I know I can treat that a lot easier than the tinnitus, right? And I know I can treat the IBS a lot easier than the tinnitus. So I'm going to address those concerns, but then how am I going to consolidate all this into as few needles as possible? Well, okay, what are some of the key points that we use for tinnitus? Let's go back to what I wrote down. I just want to take a look there. If we look at this, then we find that the second most common points recommended by like the leaders in Master Tung's system, you know, people that I've learned from, right? The second most common points that I found when I referenced the sources were 22.08 and 22.09. Okay, so I can treat the tinnitus with that, right? I can also help with the neck pain and what's going on in the levator scapulae, right? That should help with that too. And we've also got those points 33.10 and 33.11, or that area from small intestine 5 to small intestine 7, 33.10 and 33.11 we can do. So I can potentially address like their top 3 concerns with 3 or 4 needles, all on the small intestine meridian: 22.08, 22.09, 33.10, 33.11. Boom, done. I've got their top 3 concerns. I've accounted for Zong Fu patterns. I've accounted for meridian systems. And I also understand how the rhomboids are connected to the serratus anterior and wrap around the liver. And I understand the internal fascial connections as well. Okay. Whew. So do that for all your clients. Okay. Top 3 concerns. List the most important organ, a meridian next to it. You get their top 3 concerns and then just fill in the blank to find that most relevant circuit. Once you find that most relevant circuit, kind of like, well, we didn't do that with this one here, but let's go back to that other one right here. Once you find that most relevant circuit based on their top 3 concerns, then see if you can consolidate it down to 1 meridian or 2 meridians. Then you can use 3 to 6 needles. Okay. Wow, that was fun. Like, I enjoy that. It's really nice to share this. And if you haven't done the internal medicine course, I know some of you have done the first course, the 201 or the 202 course. And if you've enjoyed that course and have gotten a lot from it and it's wowed you, like the internal medicine course is going to do the same. Okay. Like there's stuff in there I haven't even gone into. There's a system in there where I talk about abdominal diagnosis. I've got a whole system in there of abdominal diagnosis that's streamlined like this, where you can just identify quadrants and then plug all this in and then done. You can use 3 points. So if you like abdominal diagnosis, this system will wow you. It's worth the cost. I'm also bringing down the cost. It's $150 right now. There's 12 NCCOM credits. If you've done the first courses, but not the internal medicine course, and you like this material, get that one. You're going to be every bit as wowed. If you try to figure it out on your own, you're going to make a lot of mistakes, and it's going to take you 4 or 5 years to unravel it. Just get it done. You'll pay for it next week because a patient will make a referral to you. Okay, so the one thing that I wanted to mention though, just to share some of this, okay. Oh, it was the other question, excuse me. There was another question that came in earlier. Okay, it's here. And it says, in your material, you mentioned Tung's stomach meridian points to 3 weights, including the scalene muscles, and therefore putting the scalenes on the superficial front line. Okay, I don't believe I said the scalenes were on the superficial front line, but you'll find some of the Master Tung sources and other teachers saying that the 3 weights can be used for conditions of the scalenes. And another of those traditional indications is that it can be used for hyperthyroid conditions, okay? So hyperthyroidism, you can use 3 weights, okay? And the question goes on to say, I'm wondering if this is a typo, as Tom Myers says, the scalenes are on the deep front line and they counteract hyperextension between the SFL and SBL. So this person was asking essentially about this relationship between the scalenes and deep conditions in the neck and throat area, hyperthyroidism being associated with the 3 weights, but the 3 weights are on the superficial front line. Okay, now this is where the myofascial anatomy helps too, because the other thing we need to know about is we need to know about needle angle and we need to know about needle depth. Okay, now you can try to memorize that stuff, but if you know the anatomy, guess what? So I can reach the deep front line, and this is how you can decrease your number of points too, from using how many ever you're using now to 3 or 6. I can needle the 3 weights, 77.05 through 77.07, and if I needle that needle right and I put it in deep, check your references on all the other teachers. They'll often say, do it 1 sun to 1.5 sun. Well, if you do it that deep, guess what? You're also going to be getting into the deep front line. So if you want to use the 3 weights to affect the thyroid or the scalenes or those deep structures in the neck, you need to be needling those deep. Does that make sense? Okay. So learn the anatomy, because just by learning the anatomy, you're going to improve your ability to like work with needle depth and needle angles as well.